Usually when you get hardware installed in your body, like a titanium pin in your ankle or maybe a plate in your arm, you just assume it stays there, right?
Right, yeah. Quietly doing its job out of sight.
Exactly. It becomes this permanent, silent partner in your anatomy. But suddenly, that invisible hardware becomes a very, very dangerous deal the second you decide to get a cosmetic or functional treatment in that exact same area.
Oh, absolutely. It changes the entire biological landscape.
It really does. And today, we are answering a question that has, well, it's totally divided clinics worldwide. If you have a synthetic plastic net permanently embedded in your pelvis, is it safe to blast that area with surgical lasers for vaginal tightening?
And the short answer to that is absolutely not.
No.
Not at all.
But, the long answer involves this massive medical plot twist that is currently redefining how we approach irreversible surgeries.
Yeah, the twist in the research right now is just wild.
It really is. So to guide you through this, we're looking at a huge stack of sources today. We've got clinical trial data, international regulatory warnings, all the way to clinical guidelines from the ACOG and RCOG.
Right, the major gynecological bodies.
Exactly. Plus some truly cutting-edge medical research papers from just the last year or two. Because for anyone who has undergone pelvic surgery, navigating this world of cosmetic or functional vaginal treatments, it can feel like walking through a minefield.
Oh, there's so much conflicting information out there.
Way too much. So our goal today is to cut through all that noise, look at the actual safety warnings, and uncover that counterintuitive plot twist. Okay, let's unpack this.
Well, to understand why combining these two things, pelvic mesh and vaginal tightening, is so fiercely debated, we really need to look at the physical mechanics of both.
The hardware and the heat.
Exactly. We are essentially talking about a collision between permanent hardware and intense thermal energy. So let's start with the hardware transvaginal mesh.
Right. And this is a product that's been utilized since, the late 1990s?
Yep, the late 90s. Mostly to treat pelvic organ prolapse, or POP, and stress urinary incontinence.
Basically, when the natural tissues of the pelvic floor become weakened, whether that's from childbirth, aging, or hormonal shifts organs like the bladder or the uterus can literally start to drop out of position.
It's a structural failure, yeah. And the mesh was introduced as a structural fix. The mesh itself is a synthetic net-like product.
It's usually plastic, right?
Yeah, most commonly woven from a type of plastic called polypropylene. The surgeon implants this synthetic net to act as a permanent hammock for those sagging organs.
Okay, a permanent hammock.
But we need to look at how the body actually interacts with this material. It's a porous structure. The body's immune system recognizes that foreign object immediately.
I mean, it is plastic inside the body.
Right. So macrophages rush in, followed by fibroblasts, which begin laying down dense collagen fibers through the actual pores of the plastic net.
Oh, wow. So it weaves itself into it.
Exactly. The body forms this intense layer of scar tissue that weaves through and around the mesh, biologically cementing it in place. It is designed to be permanent. It basically becomes indistinguishable from the tissue itself.
Which brings us to the heat portion of our equation. If someone has this prominent plastic hammock structurally fused to their vaginal walls, and then they experience, say, vaginal laxity or menopausal dryness, they might look into vaginal tightening.
And historically, that meant traditional surgery.
Right, like a vaginoplasty or a perineoplasty, where a surgeon mechanically cuts out the excess tissue and stitches the canal tighter.
Which requires anesthesia and, long recovery time.
Nobody really wants that if they can avoid it.
No, of course not. And because of those surgical burdens, the current trend has shifted heavily toward non-surgical energy-based devices, or EBDs.
Which are marketed everywhere for rejuvenation right now.
Everywhere. And our sources primarily focus on three types of these energy-based devices. First, you have microablative fractional CO2 lasers.
Okay, CO2 lasers.
And those operate at a specific wavelength of 10.6 micrometers. Second, ERYAG lasers, operating at a 2.94 micrometer wavelength. Yeah. And third, temperature-controlled radiofrequency, or RF devices, operating at 460 kilohertz.
Okay, those numbers feel very abstract. But the physics behind them is what actually matters. Yeah,
completely. Take that 10.6 micrometer wavelength from a CO2 laser. It is highly absorbed by water.
And since our vaginal mucosa is predominantly water,
the laser energy instantly vaporizes those specific cells. It essentially creates a microscopic column of thermal damage.
Got it. And then the body perceives the precise microscopic thermal damage as an injury.
Yep. Its emergency repair system kicks in. It stimulates collagen regeneration. contracts elastin fibers and builds fresh, new blood vessels in that area.
Neovascularization.
Exactly.
So it's kind of like, think of the tissue like an old stretched out wool sweater. If you apply precise, controlled heat like washing that sweater in hot water, the fibers denature, contract, and knit much tighter together.
That's a perfect analogy. The laser is basically forcing the tissue to rebuild itself tighter and thicker.
But wait, you just said this mesh is made of plastic.
Yeah.
And it's physically intertwined with the vaginal wall via scar tissue.
Deeply intertwined.
But these EBDs, these lasers, work by essentially superheating the water in that exact same wall. So are aesthetic clinics just microwaving plastic inside their patients? I mean, how does the body handle a piece of synthetic plastic getting hit with surgical-grade thermal energy?
What's fascinating here is that the physical contradiction you just pointed out is the exact reason this is such a critical medical issue.
It sounds like a recipe for disaster.
It really is. Plastic retains and conducts heat very differently than human tissue. So when you introduce intense thermal energy to an area where synthetic polypropylene mesh is thoroughly embedded, you risk uncontrolled thermal spread.
Uncontrolled thermal spread, so the heat doesn't stay microscopic.
Right. The plastic could act as a heat sink, superheating the surrounding tissues and causing localized necrosis.
Necrosis. Tissue death.
Oh my God. So you're taking a piece of plastic that might already be aggravating the immune system, and you are literally microboiling the delicate tissue right next to it.
Which explains exactly what you saw when looking through the raw data in our stack.
Yeah, you might think this is just a theoretical risk, but you can see actual panic setting across the global medical community.
Oh, definitely.
Researchers in clinical trials started quietly banning anyone with mesh from participating. Like, I was looking at this major randomized clinical trial designated as NCT 04253067. They were comparing fractional CO2 laser therapy to a sham treatment for stress urinary incontinence.
And their exclusion criteria are incredibly telling.
Very telling.
The protocol explicitly disqualifies anyone with previous pelvic mesh surgery.
They even exclude anyone who has had any pelvic or vaginal surgery whatsoever within the past 9 months.
Exactly. The researchers clearly recognize that embedded hardware, or even fresh surgical scar tissue, introduces a volatile variable they cannot safely control with a laser. And we see that exact same defensive posture in the UK's LISI protocols, specifically guidelines HTG 5801 and IPG 697, which evaluate transvaginal laser therapy.
They draw a hard line. They completely exclude women with a history of reconstructive pelvic surgery utilizing transvaginal mesh kits.
Even down at the consumer level, like routine clinic post-care and consent forms list a history of reconstructive pelvic surgery with mesh as an absolute contraindication.
You physically have to sign a legal document swearing you do not have this hardware in your body before a technician will even turn the machine on.
But why is the baseline so risky, even before the laser?
Well, we have to look at the pre-existing baseline of a patient with pelvic mesh to fully grasp the danger. Polypropylene mesh is already highly controversial because it's prone to severe complications entirely on its own without adding lasers to the mix.
Right. The FDA and other global regulators have been managing the fallout of these implants for years.
Over time, the vaginal tissue overlying the mesh can thin out or degrade.
Which leads to erosion, right? Where the rigid plastic mesh literally slices through the thinning vaginal wall and comes exposed.
Yeah, erosion. And when erosion occurs, it triggers chronic, debilitating pain in the pelvis, lower back, and groin. It can cause severe dyspareunia.
Making intercourse incredibly painful.
Extremely painful for both the patient and their partner. The mesh can also shrink and contract over the years, causing the vaginal tissue to pull unnaturally.
So if a patient is already experiencing microscarring or low-grade inflammation from the mesh hitting that compromised tissue with a 10.6 micrometer CO2 laser or high-frequency radio waves, is just going to push that tissue past its breaking point.
It's actively inducing trauma on tissue that is already struggling to survive over a piece of plastic.
And the American Urogynecologic Society, the AUGS, they issued a consensus statement acknowledging this reality, didn't they?
They did. They noted that some patients with mesh have anecdotally gone to med spas and received these laser treatments, but they bluntly stated there is little data in the literature to provide supportive evidence for safety.
Basically, they deliberately refused to reach a consensus, saying it was safe.
And when medical societies highlight a vacuum of safety data regarding a popular cosmetic procedure, regulatory agencies inevitably step in.
Enter the FDA.
Right. In July 2018, the FDA issued a stark public warning. They specifically warned against using energy-based devices for vaginal rejuvenation.
citing that safety and efficacy simply haven't been established.
And they cited terrifying reports of severe adverse events. We're talking severe burns, aggressive scarring, and chronic pain.
And Australia went even further. Their Therapeutic Goods Administration, the TGA, conducted a massive post-market review and made the unprecedented decision to cancel all registrations for EBDs used for vaginal rejuvenation.
Pulling them entirely from the market effective in 2025.
Yeah, they determined the lack of long-term safety evidence was just too great a risk to public health.
This profound regulatory action really highlights the vast chasm between a heavily marketed cosmetic procedure and a rigorously tested, evidence-based medical treatment.
So what does this all mean? Let's connect this directly to you, the listener. If you have had pelvic mesh implanted, or any pelvic reconstructive surgery, and an aesthetic clinic offers you a quick laser tightening session for menopausal symptoms without deeply investigating your surgical history, that is a massive, flashing warning sign.
A huge red flag.
The risk of triggering mesh erosion, causing internal burns, or worsening scar contracture is a documented reality. The clinical consensus across our entire stack of sources is unambiguous. For the purpose of cosmetic tightening or rejuvenation, transvaginal mesh is an absolute contraindication.
The rule is established. Lasers and mesh do not mix for rejuvenation.
But, and this is big but, as we were digging through the very latest research papers from 2024 and 2025, we hit a paradox.
The plot twist.
Yeah, I was looking at these new peer-reviewed clinical studies and I had to stop and ask, if energy-based devices are strictly forbidden for people with mesh, why am I looking at brand new research papers where urogynecologists are using these exact same lasers on patients who are actively suffering from mesh complications?
Because medical science is completely flipping the script on how we view tissue damage.
It's wild.
To understand this twist, we have to look at the clinical nightmare of trying to remove mesh once it goes wrong. Remember, the body's scar tissue weaves perfectly through the pores of the plastic.
Right, they become cemented together.
Exactly. The mesh integrates intimately with delicate structures, so substantial removal requires a surgeon to perform blind dissection through cement-like scar tissue.
Millimeters away from the bladder, the bowel.
Major blood vessels, vital nerves.
I mean, sometimes surgeons have to go in through the abdomen, sometimes they have to carve through the groin. It is a highly invasive, incredibly risky surgery.
And frequently, even after multiple agonizing surgeries, they simply cannot extract all the plastic.
So because surgical excision is so dangerous, researchers began asking a radical question.
Right. Instead of using thermal energy to deliberately shrink healthy tissue for cosmetic tightening, could we use highly calibrated microscopic thermal damage to stimulate healing in the tissue that the mesh has already destroyed?
They are taking the exact mechanism that causes danger tissue heating and repurposing it into a cure. It's just brilliant. And the data on this is staggering.
Oh, the Willison paper.
Yes. There is a breakthrough paper by Willison and colleagues published in the International Urogynecology Journal dated April 2025.
Such a crucial study.
They gathered a cohort of 47 women who were actively suffering from severe symptomatic mesh complications, like chronic pain, abnormal discharge, and actual vaginal mesh exposure, where the plastic was visibly protruding through the vaginal wall.
These patients were literally on the surgical waiting list to endure the brutal mesh removal surgeries we just described.
But instead of putting them under the knife, the researchers treated them with a highly specific protocol, combining platelet-rich plasma, or PRP, and fractional CO2 laser therapy.
The exact same laser the FDA warned against for cosmetic use.
Exactly.
But the mechanism of action here relies entirely on dosage and intention. By applying incredibly precise microablative pulses of the CO2 laser directly to the scarred, compromised tissue around the exposed mesh.
They intentionally triggered that neovascularization process we discussed earlier.
Right. They forced the body to build new blood vessels and deliver fresh nutrients to a localized area that was essentially dead scar tissue.
And over an average 12-month follow-up, the results were astonishing. Out of those 47 women, 40 of them, which is 85%, avoided surgery altogether.
85%, that's incredible.
The targeted thermal energy stimulated the vaginal tissue to regenerate and physically heal over the exposed plastic mesh. Their pain decreased, and their quality of life fundamentally improved, purely through light energy and plasma.
And we see this exact mechanism corroborated in a 2024 case series by Dr. Okui. He focused on women with severe vaginal erosion caused by polypropylene mesh.
Including patients who had already endured failed extraction surgeries, right?
Exactly. But he utilized a non-ablative air YG laser. This means the laser doesn't vaporize the top layer of tissue. Instead, it penetrates deeper to heat the underlying layers without breaking the surface. He targeted the irradiation directly at the margins of the tissue erosion.
And when researchers actually put these treated cells under a microscope to look at the histopathology, they saw something amazing. The tissue wasn't burned.
No, the laser-induced intense cellular regeneration right at the junction where the plastic met the human tissue. The chronic bleeding stopped, the tissue thickened, and the erosion sealed itself.
Here's where it gets really interesting. We've gone from never use lasers if you have mesh because it's a catastrophic risk to precise low-dose lasers might be the exact biological trigger that saves you from a dangerous mesh removal surgery.
It's all about intention and precision.
But there's one more piece of technology detailed in our sources that genuinely sounds like a sci-fi tractor beam. It's called modulite technology.
Oh, this represents the absolute frontier of managing embedded hardware. Modulite is currently exploring the use of a 647 nanometer laser for an application they call selective laser vaporization of the mesh.
Wait, selective vaporization? Are they aiming a laser into the body and just, like, sublimating the plastic?
Essentially, yes. They are vaporizing the plastic non-invasively, utilizing a physical principle called selective photothermolysis.
Selective photothermolysis.
Think of it like tuning a radio to a very specific station while ignoring all the static. They use a highly specific wavelength of pulsed laser radiation 647 nanometers.
Okay, and why that specific number?
Because this specific wavelength is highly absorbed by the polymer bonds of synthetic polypropylene, but it is almost entirely ignored by the water and blood in the surrounding human tissue.
Wow. So the laser passes harmlessly through the vaginal wall, hits the exposed plastic mesh, and the plastic absorbs all the energy until it simply vaporizes.
Exactly. It's working on a millimeter scale, selectively melting away the offending hardware while leaving the delicate human biology completely untouched.
That is wild.
It theoretically bypasses the entire need for a surgeon to take a scalpel and hack through layers of scar tissue. You eliminate the risk of accidentally puncturing the bladder or severing a nerve because the light energy only recognizes the plastic.
It's just an extraordinary application of physics.
If we connect this to the bigger picture, it fundamentally changes how we view medical devices. The tool itself, the laser, is completely neutral. The physics don't change, but the context and the application dictate everything.
Right. If an aesthetic clinic blindly fires a 10.6 micrometer CO2 laser into a vaginal canal just to shrink the tissue, and they unknowingly hit embedded transvaginal mesh,
They can cause uncontrolled thermal spread, severe burns, and trigger horrific erosion. That is a dangerous, contraindicated misuse of the tool.
conversely, if a specialized urogynecologist utilizes that exact same CO2 laser at a highly calibrated low-dose setting to stimulate microscopic blood flow over a failing mesh site.
Or utilizes a 647 nanometer laser to selectively vaporize a protruding shard of plastic.
That is a life-saving medical breakthrough. It's the difference between blindly slashing a canvas with a scalpel versus using that same scalpel to execute a flawless open-heart surgery.
Exactly. The intention, the rigorous anatomical training, and the microscopic precision redefine the nature of the tool entirely.
That is the vital distinction that answers the core mission of our deep dive today. So, to bring it all together for you, are pelvic mesh and recent pelvic surgeries absolute contraindications for standard cosmetic vaginal tightening? The answer is a resounding, definitive yes.
Absolutely, yes.
If you are seeking cosmetic tightening for laxity or menopausal symptoms, and you have transvaginal mesh permanently embedded in your pelvis, energy-based devices are strictly off limits. The risks of exacerbating mesh erosion, causing internal necrosis, or inducing chronic pain are a documented physical reality.
The FDA and international bodies have made it abundantly clear that safety for general rejuvenation is not established, and having hardware in your pelvis elevates that risk to a critical level.
But the incredible nuance we discovered today is that the technology of lasers isn't being abandoned. It is being highly calibrated and repurposed in highly controlled clinical settings to actually treat and heal the devastating complications of the mesh itself.
And this raises an important question, and it's a concept I want to leave you with to ponder.
Oh, I like where this is going.
We have just explored how scientists are learning to use specific wavelengths of light to selectively vaporize synthetic plastic mesh inside delicate human tissue, millimeter by millimeter, completely avoiding the trauma of open surgery.
Which is an incredible leap forward for pelvic health.
Right. But if we are mastering the physics of selective photothermolysis to safely remove transvaginal mesh, what does this imply for the future of all other failing medical implants?
Oh, wow.
When a pacemaker wire gets irreparably scarred into a cardiac vein, or a synthetic joint replacement fails and becomes encased in dense scar tissue, extraction today is a brutal, high-risk surgical undertaking that sometimes kills the patient.
Yeah, it's incredibly dangerous.
Could we eventually see a near future where we utilize non-invasive, precisely calibrated light energy to selectively vaporize or detach these failing implants from the inside out without a surgeon ever making a single incision?
That is a staggering thought. Taking permanent, dangerously embedded hardware that surgeons are terrified to touch, and literally dissolving its anchors with light. It just goes to show that what we consider a permanent, irreversible medical limitation today might simply be waiting for the right wavelength of physics tomorrow.
It really is just the beginning.
It is. Thank you so much for joining us on this deep dive. We love untangling these messy, surprising medical realities with you. Until next time, keep asking the hard questions. And remember, sometimes the exact mechanism that makes the hardware dangerous is the key to unlocking the cure.